Hi everyone, I'm Whitney and I am doing a case conceptualization, reading the presentation outline from our week 4 discussion for Haley Brantley. Haley is an 11-year-old Caucasian female who is early in adolescence. She is nearing the end of her 5th grade school year at Rising Scholars Academy in Berkeley. Haley lives in a single-family home with her mother, grandmother, and older brother. Presenting concerns, Haley presents as an emotionally unstable and withdrawn young lady. She does not dress in appropriate school attire, and her hair is unkempt. Her weight is slowly decreasing, and she is failing all of her classes and does not think that anyone can truly help her, although her teachers are noticing her decline in behavior. Concurrent problems. Haley does not have any diagnosed mental health issues. However, her presenting behaviors are similar to symptoms of depression. A little background history. Until age 9, Haley lived in a household with her mother and her father. Her parents had been married for 10 years. Her mother was a hospital receptionist and her father was a well-known brain surgeon. But on Haley's 10th birthday, her father came home with divorce papers. For about 6 months after that, there was non-stop arguing in her home. Alcohol, marijuana, and oxycodone are part of her mother's family history and became frequent in their home. Her mother started to give more attention to substances than to Haley. She blamed her for ruining her life. Her father left Haley and her mother like a thief in the night once the divorce papers were signed, and did not contact them until he was ready to get married again. Some strengths of Haley. Haley may no longer have a nurturing relationship with her mother. However, her father can provide a stable home for her if she chooses to reunite with him. Although her grades are failing, she is still showing up to school daily and trying her best to participate in classes. Haley still has support from her older brother and her grandmother in the home. She also has support from staff members in her school who see how her home environment has negatively affected her. Interfering factors and barriers. Her mother's substance use will be a major barrier to Haley's progress in treatment. Haley does not use any substances. However, there is a possibility that she could be tempted to participate in them when she feels overwhelmed. Haley's lack of support from her mother is also a negative factor in her potential treatment plan. Her mother blames her for ruining her life. Haley's behavior could become even more concerning from that. For example, her depressive behavior can progress to suicidal behavior or suicide ideation. Haley's father abandoning her and her mother could also be a negative factor in her potential treatment plan. If Haley feels as if her father abandoned her when she needed him most, she might struggle to trust anyone in her future. A few goals that Haley and I have come up with. Plans for treatment. Number 1, identify current strengths and weaknesses. Goal number 2 is identify root causes of depressive symptoms. Goal number 3, communicate feelings of sadness and explore them. And goal number 4, identify your personal definition of self-love. Those are 4 goals, but are not limited to only 4. But let me know what you think.